What if the most powerful tool for fighting your rheumatoid arthritis wasn't found in the pharmacy, but in your kitchen and your daily routine? We asked leading rheumatologist and a lifestyle expert, Dr. Quinn, who has more than 30 years of experience in comprehensive management of chronic diseases, including rheumatoid arthritis. We'll hear from her on how to go beyond medication to manage inflammation and reclaim your life from autoimmune diseases. Welcome to our show, Dr. Quinn.
Thank you so much. It's my pleasure to be here. Thanks so much for the invitation.
Sure, and happy that you are here. So start with the discussion on lifestyle medicine in rheumatology and autoimmune disease. Can you give our audience a little bit of a sense of how it applies to rheumatology and lifestyle medicine?
In lifestyle medicine, we are always working in collaboration with the patient's primary care providers and any specialists that are involved in their management. But what we do in lifestyle medicine is we focus typically on four main elements. The first being nutrition, the second being what we call movement, that is how one's engaged in moving their body on a daily basis, mindset, which has to do with stress management and emotional well-being, and then sleep, which for many individuals is the most underappreciated tool that they have in their toolkit when it comes to promoting health, but specifically in the case of patients with rheumatology, managing chronic inflammation, which we know is sort of the root cause of so many of the illnesses that we treat in rheumatology.
Excellent. Now, even I had made a mnemonics out of what you just mentioned. I call NESS: nutrition, exercise, sleep, and stress management. So it's easy to understand. So I tell everybody, all of my patients, you have to follow that NESS framework: nutrition, exercise, sleep, and stress management.
Yes, absolutely.
Now, going a little more deeper on, let's start with the nutrition. So get a little more understanding of why nutrition is so important in autoimmune conditions.
Well, I think it starts with the whole concept of inflammation and what's going on in the bodies of individuals who have chronic diseases like rheumatoid arthritis, for instance, a chronic systemic inflammatory illness. What we're trying to do when we help folks with lifestyle medicine is to tune down that inflammatory process with tools that they themselves can initiate and manage. As you know from caring for patients, it's so important when they're empowered to be co-managers in their care. And that's certainly the case with lifestyle medicine. Patients themselves can take control. But inflammation is an important tool in our body. It helps our body fight infection. It helps improve circulation to places in our body that are healing. But when there's chronic day in and day out inflammation rather than just acute inflammation, that begins to cause harm. What we know is that the foods that you choose to eat and the way that you choose to eat those foods can have a big impact on inflammation. And the big picture is to try to focus on eating real food, whole food, and to stay away from what we call processed and sometimes even ultra-processed foods. Processed foods being those that have been refined or changed so that they can be packaged and sit on a shelf for a long period of time, which takes away from the real value of whole food.
Now, many of my audience, they usually ask me the question is, what is the link? What is the science behind the food that we take and then the risk of autoimmune disease? So can we have you explain a little more detail on why food causes inflammation?
To go back to some of the elements that are present in real food but absent in processed foods. If one is eating whole food, then we know that those foods are going to, first of all, provide usually a lot of fiber. That's an important part of fruits and vegetables. And what we know about including fiber in our diet is that it does affect the microbiome in a way that does help promote anti-inflammatory success. Our gut microbes break down fiber into short-chain fatty acids, and those have anti-inflammatory anti-inflammatory properties. We know that individuals who eat a high-fiber diet can impact their C-reactive protein, a marker of inflammation. And there is evidence that high-fiber diets will also increase the prevalence of other inflammatory illnesses. So you and I worry about our patients who have chronic diseases like rheumatoid arthritis being at risk for cardiovascular disease, which at its root is an inflammatory condition. And we also have learned so much about the microbiome and how our nutrition impacts the healthy microbiome, which then protects the gut barrier so that inflammatory processes and inflammatory elements don't enter our system and trigger more inflammation. So that's just one of the things that we know about a whole food, real food diet and how it can impact inflammation. So other things that are present in that type of, and let me just also go back and say that there have been a number of studies that have looked at specific diets to try and combat inflammatory conditions, including the Mediterranean diet and the DASH diet. But the important thing to know is that those all have these same themes. They all have this focus on real food, whole food, rather than processed food at their core. And there isn't really an anti-inflammatory diet. It's eating with these methods, these themes, these concepts in mind. Are there specific types of food content like antioxidants, omega-3 fatty acids, polyphenols, things like that you would like me to address? Because those are all parts of a whole food, plant-based or plant-forward healthy diet.
Absolutely. Let me quickly recap on what you told, some of the important information, particularly the role of fiber on combating inflammation looks like, right? Fiber has a key role in combating inflammation, and even high fiber diet is known to decrease the C-reactive protein, which is one of the marker we use to understand inflammation in rheumatoid arthritis. So what we just heard from Dr. Quinn is the important role of increasing your fiber diet. That'll eventually decrease your risk of having cardiovascular disease because it decreases your C-reactive protein, which is one of the inflammatory markers that leads to multiple conditions, including autoimmune disease as well as heart diseases. So it has a multiple role, including autoimmune and non-autoimmune diseases. So as Dr. Quinn was mentioning, let's go a little more detail on those chemicals that we were mentioning, the polyphenols and those type of things. So let's help our audience understand where can they get those in those type of chemicals. What are the food that has high in those chemicals?
Well, let's talk about omega-3 fatty acids. People have often heard about omega-3 fatty acid. So the standard American diet has drifted away from the diet that mankind was accustomed to years ago, where we had a balance between omega-3 and omega-6 fatty acids being a building block of nutrients. So what we know that about omega-3 fatty acids is that they are frequently found in cold water fish, walnuts, flaxseed, leafy green vegetables like spinach and kale. These are foods that are particularly high in omega-3 fatty acids, and they are excellent at reducing inflammation through several different mechanisms. They alter the body's buildup of pro-inflammatory cyclooxygenases that we are familiar with in rheumatology and are precursors to anti-inflammatory eicosanoids, including things called resolvins, protectins, marasins. They also mediate cell-mediated immunity, which is at the core of rheumatic diseases, influencing T cells and helper T cells to reduce their inflammatory response. And they again have a great impact on the gut microbiome in a way that reduces inflammation. So some of these themes come back again and again, how important the gut is to controlling inflammation and how changing the mediators of inflammation can make a big difference. Let me add that one of the ways that we help our patients remember the kinds of cold water fish that are rich in the omega-3 fatty acids is we use the word SMASH, which stands for salmon, mackerel, anchovies, and sardines and herring. Not the most common fish folks would choose, but fish that are extremely high in omega-3 fatty acids.
So if they can eat the smashed food, they usually get a lot of omega-3 fatty acid, looks like.
Yes, that's right.
Okay. Okay. Now, is there any concern of consuming too much of this omega-3 fatty acid? Are there any risks we need to be aware of if they use any supplements?
Not to my knowledge. You do have to be cautious, though, when you're selecting the fish that I just mentioned. Many of these fish are a little bit higher up on the food chain. So sardines are not, but tuna may be. And in the world that we live in today, one does have to be cautious about the risk of mercury in these fish. And so you can choose on the shelf the products that are evaluated for the mercury content, including a product called Safe Catch, so that you can keep track of that exposure that does come with being around. But I'm not aware of issues with excess omega-3 fatty acids. The standard American diet is so full of omega-6 fatty acids, it's hard to get to healthy balance.
So that means we consume more of omega-6 than the omega-3 sounds like.
So, well, we get plenty of omega-6 without even trying. And so we really have to try and balance that with the omega-3 fatty acid. Yeah, I think that people have assessed that at one point the balance was 1-to-1 in the diet that humans were eating. And now it's, 10 to 20 times that much omega-6 to omega-3 fatty acids in a standard American diet. And a standard American diet is going to be a diet where at least 60% of the foods are processed foods rather than whole foods.
And can you elaborate more on the risk of taking that excess omega-6 and less of the omega-3? I think we heard about inflammatory versus other systemic conditions too.
By impacting the mediators of inflammation, modulating immune cell function, and impacting the gut microbiome, those are all different ways that the omega-3 fatty acids will help deliver anti-inflammatory rather than pro-inflammatory benefit to an individual's body.
Got it. And it looks like the taking fish or the supplement omega-3 fatty acid is like taking over-the-counter like ibuprofen or naproxen, right? Which also has those anti-inflammatory, but you are taking another extra chemical. But omega-3 is more natural anti-inflammatory that help reduce mild to moderate amount of inflammation.
Right. And there are other foods that walnuts, when you look at nuts, they are extremely high in omega-3 fatty acids, and then green leafy vegetables are abundant in a whole food diet and will also provide.
So before we leave, Dr. Kun will explain us how or what are the simple actionable items each of you who have rheumatoid arthritis can do on a daily basis to make you feel better with lifestyle and dietary changes.
One of the tools that we teach our patients when they go to the grocery store is to think about traveling around the outside of the grocery store rather going to the center of the grocery store. If you will stay on the outside of the grocery store, you are much more likely to find the kinds of foods that I'm talking about. Walking through the produce area, going to the meat section and the fresh fish section, but avoiding all of the crackers, cookies, pre-made meals that are in the freezer department, where you're going to bump into foods that have been refined, have lost their fiber, have lost many of their micronutrients, and are going to be full of additional salt and saturated fat. The other things that we do are encourage patients to eat in the season. Eating real food, whole food, can be a more expensive way to eat, and certainly folks that are on a fixed income. But if you can take advantage of the things that are in season, then that's another way to really amplify your success with this.
Excellent. I love how you put it, that going around the store, not in the middle of the store. That's a very easy way to understand what is the best food you should buy rather than all the middle section where you have all the highly processed and canned food, which are not the best for your overall health.
Right.
Now, before we depart, Dr. Quinn, can you tell a little more about our audience and what you do, how they can find you, and how they can use your services?
So I practice lifestyle medicine with a team of registered dietitians, and we are a virtual practice, so you can find us online. We serve residents in the state of North Carolina, so if you live in the state of North Carolina, we would be delighted to meet you and work with you. You do not need a physician referral to see us. Our practice is called Whole Health Partners, WHOLE, Whole Health Partners. You can find us online. You can make an appointment online. We love to be members of your team, so we will always ask you to communicate with the other people that are taking care of you, but we would be anxious to help anyone who is struggling with rheumatic disease or any other chronic condition, or who is worried about the potential to develop a chronic condition because of a family history or exposures that they've had.
Excellent. Thank you so much for your time today, and I hope all of you enjoyed and learned quite a bit of things related with lifestyle medicine, focusing more on diet. And if you like the video, please like and subscribe for more similar content on how we can fight against this indivisible battle of rheumatoid arthritis and other autoimmune condition using lifestyle changes as well as medical treatment. And then stay healthy. Take care. Bye-bye.